To date, the Ministry of Health and Social Services, in partnership with Abt Associates and other implementing partners, have ensured that the circumcision of over 270,000 males from the age of 15 and older under the SMARTCUT campaign. Now, despite a low uptake of male circumcision between 2014 and 2017 due to low levels of awareness, the goal of reaching 300,000 is fast becoming a reality. To give us more details on this milestone is Voluntary Medical Male Circumcision Demand Creation Manager, Johannes Haufiku. Very good evening to you, and thank you so much for coming on to the show.
Thank you very much for having me, and good evening.
Talk to us about the voluntary medical male circumcision and why was it initiated?
Well, male circumcision is one of the strategies that have been recommended by the World Health Organization. And the country started Namibia with a generalized epidemic and very high HIV prevalence and low male circumcision rate. This was one of the strategies that could essentially help the country to reduce new incidences of HIV, amongst other strategies within the combination prevention of the country.
Well, 270,000 circumcisions is such a big number. What does this mean for Namibia?
Well, what it means is research has shown that when you circumcise close to 80% of the sexually active men, then you can essentially reduce new incidence rate by, say, about 60%. When we talk about male circumcision, we say it reduced the chances of HIV for a man by 60%. But it also does the same at population level if you have more men that are circumcised. And this currently translates into about 64% prevalence when it comes to male circumcision rate, which is quite good for the country. And I think we are in the right path to reach close to 80%. And now recently with the new strategy, we are looking at reaching 90% of the sexually active population of men.
That's 90% of the population.
Yes.
Well, please highlight to our viewers
male population. Yes.
Male population, yes, of course. Now, please highlight to our viewers the importance and the common benefits of circumcision.
Well, once again, research has shown that when a man is circumcised, he reduces the chance of acquiring HIV by about 60%. Which he also reduces the chances of acquiring sexually transmitted infection. And this happened because the foreskin, inside the foreskin, there is the Langerhans cells, which makes it easy for the acquisition of HIV, because these Langerhans cells are part of your immune system. So basically when you get an infection, they take in that infection so that the immune system can destroy it. But in this case, HIV actually destroys the immune system. So when you have the foreskin, that is the risk you have. But once it's removed, that risk is reduced. The other benefit is improved hygiene for men. Basically by not having the foreskin, whatever residue is left between the foreskin and the glands of the penis can no longer happen because the foreskin is not there. Because the foreskin tends to cover up whatever is inside, and that really can also create other health conditions for men. And it also reduces the chances of penile cancer amongst men. And for women with a circumcised partner, it also reduces the chances of cervical cancer in women because of the human papilloma virus that is present inside the foreskin. And when that is deposited over time, into the woman can then result into chances of cervical cancer. So just to mention a few, those are the benefits of circumcision.
Right. Now talk to us about the best age for this surgical procedure.
The best age, it can be done at any time, from the moment the boy is born to whatever later stage. But for this project, we concentrate on the sexually active, and therefore we start from the age of 15. And the age of 15, we're also starting at that age because of the type of instruments that we use that might not be conducive for the younger ones. So, but for any parent out there with a child that is younger than 17 or a small baby, you can still do it. You can go to your private doctor and they will do it. So we can't say which age is the best, but for the project we are funded to start from 15 and above. Thank you.
Now, would you say that there are any complications post-circumcision?
Complications. When a man is circumcised, we give him instructions to follow, and these are like post-operative instructions to make sure he heals according to the way it's set out to happen. So in case these instructions are not followed, they may cause complications, they may cause adverse events. Also, during the medical review of the client, if they were not able to divulge certain information or certain illnesses that can later cause adverse events, that may also happen. You have people with bleeding disorders and so many other things that the medical team need to know about that before they conduct the circumcision so that they know how to handle it. So in many cases, what we have seen as adverse events is basically sometimes people not following the instructions set on how to care for the wound. And also, we are saying that after circumcision, there is a 6-week period where you abstain from sexual intercourse, meaning that if a client has to do that earlier than that, that can also cause like disruption of the wound, and that causes other complications. But so far, in terms of our adverse event rate or any complication is very low, below 1%.
Right, thank you. What are some of the, just in closing, what are some of the activities and initiatives that are set out to attract more males to get circumcised?
Great question. One of the activities, we actually have a range of activities, especially when it comes to demand creation and service provision. So in terms of demand creation, we also hoping to use more of the celebrities, ambassadors out there to help push the message. And also in terms of service provision, we will continue to roll out the outreach services because that brings services close to the people. As we know, Namibia is a vast country and our health facilities are far. So we've been very successful by rolling out outreach programs. In terms of demand creation, it's also kind of creating a campaign that will kind of target different outlets, social media, to go on radio, newspapers, and also use community engagement. One of the key one in closing is the multi-sectoral approach, where we intend to continue to work with different stakeholders, government entities, private, civil society organizations, just to make sure we bring the message home and we bring services closer to the people.
Well, Mr. Haufiku, thank you. We appreciate you coming onto our program this evening.
You are most welcome.
That is, of course, Johannes Haufiku. He is the Voluntary Medical Male Circumcision Demand Creation Manager, talking to us there about that initiative of wanting to circumcise over 270,000 males from the age of 15 and older with the SMARTCUT campaign. Well, we are now taking the local news roundup, and then we'll be back with more.